Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog, you've discovered the 5 ways how resilient families in intensive care stand back up when life knocks them down. You can check out last week's blog by clicking on the link below this video. In this week's blog, I want to share with you how to stay strong whilst your loved one is critically ill in intensive care. Staying strong is one of those golden nuggets. It's a skill, it's a quality that families of critically ill patients in intensive care desperately need when one of their loved ones has been admitted to intensive care. And staying strong is what many families of critically ill patients in intensive care are doggedly determined to be, to only find that if their critically ill loved one is either very unstable and in a very critical condition, or is in a life-threatening situation, or is in intensive care for long-term treatments and long-term stays, or is having a severe or traumatic head or brain injury, or is threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order, or their loved one is in a situation where the intensive care team suggests a withdrawal of treatment or a limitation of treatment as being quote-unquote in the best interest of your critically ill loved one, or your loved one may even be approaching their end of life in intensive care. That staying strong in this once-in-a-lifetime situation is easier said than done. And the truth and the fact of the matter is that 99% of families of critically ill patients in intensive care who have no peace of mind, who have no power, no control and no influence, consciously or unconsciously decide to give in to the perceived power and the perceived authority of the intensive care team, and therefore also consciously or unconsciously decide to stay weak. Therefore, more often than not, staying strong has given way to the agenda of the intensive care team, and most families of critically ill patients in intensive care are only passive bystanders, and they have things happen to them rather than being a master of their own destiny. Staying strong when having a loved one critically ill in intensive care isn't easy, because you and your family are facing your worst nightmares. Staying strong when your loved one is critically ill in intensive care is something you can achieve, however. You need to start going against the grain. You probably need to do some counterintuitive moves, and you need to do what the 99% of families of critically ill patients in intensive care who don't have peace of mind, who don't have power, who don't have control, and who don't have influence are not doing. Staying strong when your loved one is critically ill in intensive care, and when the intensive care team has laid down the train tracks and knows what to say, when to say it, and how to say it, even if, or I shall say especially if your loved one is either very unstable and in a very critical condition, or they are in a life-threatening situation. They may be in intensive care for long-term treatments and long-term stays. They may be having a severe or traumatic head or brain injury. They may be threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order. Or they may be in a situation where the intensive care team suggests a withdrawal of treatment or a limitation of treatment as being quote-unquote in the best interest of your critically ill loved one, or they may be approaching their end of life in intensive care. This can be a daunting challenge. However, you can stay strong if you are laying down your own train tracks, if you are not intimidated by the perceived power and by the perceived authority of the intensive care team. Staying strong in the face of adversity, staying strong when your body language screams of your insecurities, your fears, your frustrations, your pain and your vulnerability. And staying strong when life has knocked you down is a skill that you can quickly develop with the right type of advice. Staying strong when the tone of your voice is closer to crying and closer to a nervous breakdown than having composure and strength is a skill that's not optional, and it's a skill that you can develop and master with the right type of advice. Now, I can tell you that after more than 15 years intensive care nursing in 3 different countries, and after I have worked with literally thousands of critically ill patients and their families, staying strong starts with having the awareness that 99% of families in intensive care have no peace of mind, no control, no power, and no influence. Staying strong starts with you having the guts, the belief, the courage, and the faith that you can be a master of your own destiny. Staying strong starts with you looking around you and look at what everybody else is doing and doing the complete opposite. Remember, 99% of families of critically ill patients in intensive care have no peace of mind, no control, no power, and no influence, and by no means do you want to copy or model what they are doing. Staying strong starts with you having an awareness that your body language sucks, and that the minute you enter the intensive care unit, everybody can see that your back is hunched, that your shoulders are pulled inwards rather than outwards, that you avoid strong eye contact, that your head is down, and that your handshake is weak. Staying strong starts with you taking full responsibility for what is happening from now on. Staying strong starts with you questioning the intensive care team and looking behind the scenes in intensive care. Staying strong starts with you developing the awareness that the intensive care team's agenda is mainly driven by their financial interests, their budget targets, their bed management pressures, the politics, the dynamics, the competing interests, the power play, the intrigue, and the psychology at play in an intensive care unit. Staying strong also includes developing the awareness that the intensive care team has medical research interests, and that medical research interest is performed on real critically ill patients in intensive care in real time, often without you and your critically ill loved one knowing about it, let alone you or your critically ill loved one having given either written or verbal consent to it. Staying strong means that you need to know that the positioning of your critically ill loved one's prognosis and diagnosis by the intensive care team often goes way beyond your critically ill loved one's prognosis and diagnosis. Staying strong means that you and your family need to know and understand that intensive care is a multi-billion-dollar per year industry in this day and age, and the sheer amount of money that is exchanging hands opens the doors for all sorts of ethical and moral dilemmas and issues. Staying strong when your loved one is critically ill in intensive care means that you need to throw away all of your preconceived ideas about intensive care. Staying strong when your loved one is critically ill in intensive care means that you and your family need to make up your own mind, irrespective of what the intensive care team is telling you. Staying strong means that you and your family shouldn't buy into the doom and gloom picture that the intensive care team may have painted. Staying strong means that you need to have an agenda, goals, and outcomes that you want to achieve for your critically ill loved one, irrespective of what the intensive care team is telling you. Staying strong means that whenever you and your family are asked to have a formal family meeting with the intensive care team, that you have strong positioning, mental clarity, and that you pursue your own agenda rather than buy into the doom and gloom of the intensive care team. Staying strong means that whatever the intensive care team is telling you when your critically ill loved one is either very unstable and in a very critical condition, or is in a life-threatening situation, or is in intensive care for long-term treatments and long-term stays, or is having a severe or traumatic head or brain injury, or is even threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order, or they're in a situation where the intensive care team suggests a withdrawal of treatment or a limitation of treatment as being quote-unquote in the best interest of your critically ill loved one, or your loved one may even be approaching their end of life in intensive care. In those situations, you must leave no stone unturned, and that so that you have the strength, the determination, the power, the control, and the influence that will ultimately lead you to peace of mind, no matter how difficult the situation. How can you do that? How can you leave no stone unturned? And how can you quickly get peace of mind, control, power, and influence whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power, and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section where we answer your questions, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.